how are you doing? It's Elaine Bintz, certified health coach, personal trainer, and it's day 6 of our 30-day health challenge. I hope everybody is having a great week so far. Today's topic is glucose or blood sugar. So the measurement or the number we're talking about today is fasting. So we're talking about your fasting. If you have a comprehensive metabolic panel, if you have your most recent metabolic panel, I'll be using mine as a reference. Your blood test, you want to have a fasted blood sugar number, and fasting here means like not consuming calories like 8 to 10 hours before you get this blood draw. So I'll do a separate video later down in the challenge about intermittent fasting. So that's not what today's topic is. Today's topic is more so about the blood value. So when I talk to people about their risk for developing diabetes, oftentimes I'll ask them, do you know what your most recent, blood sugar numbers were? And then we can discuss what the ranges mean. So first off, tools or resources you might want to have if you have access to your metabolic panel. What is a metabolic panel? So your body's metabolism, all the chemical processes that occur in your body based on what you eat will affect your body. So when you get a blood draw, it'll give you all this awesome feedback and tell you just a snapshot of your current health for the time that you fasted. So if you look at your metabolic panel, the one I'm using today, it'll say glucose, but it means the same thing as blood sugar. And then there will be a norm range. So there are slight variations, just so you're aware. There are slight variations if you go to one lab versus another. So if you notice a discrepancy, a couple of numbers, don't get hung up on like the just couple of numbers, but more so look at the big picture for the ranges. So what is healthy? So you're looking at your numbers and you're not quite sure, and there might be an H by one of your numbers on your blood test results. A healthy range for blood sugar is 99 or lower for milligrams per deciliter of blood. So that's like a measurement of how much of the sugar they're finding in the blood. So that's healthy. That means you would not be at risk, hopefully, for diabetes. And then if it was between your fasting glucose or fasting blood sugar number, if that number was between 100 and 125 milligrams per deciliter, that will put you into the category that's called pre-diabetic. So what does that mean? So that means you're at risk for developing diabetes. So this is a warning sign. So a lot of times your doctor, say you go for your annual physical and they run some numbers, they get your blood work done, and they come back and they say you are at risk. How do they know that? How do they know that you are at risk? It's because your blood sugar is elevated. So that's a warning sign that you want to make some dietary adjustments or some changes in your lifestyle. Sometimes your doctor will prescribe a medication. Again, I'm a holistic practitioner, so if you were to come to me during that time period, I will of course support whatever your physician is encouraging you to do in regards to medication, but I'd like to discuss some holistic ways to lower this number. And one of the first ones usually is to get your body in a healthier weight range. And you can go back to that BMI video to kind of see what would be a good general place to have a healthy body weight for your height. And then what is diabetes? That would, if your fasting blood sugar or blood glucose was 126 milligrams per deciliter or greater, your doctor might diagnose you with diabetes. Okay, so what's the risk? Why? Who cares? People are often asking, well, yeah, it's very common. Everyone I know, they're starting to get these diagnoses. Well, the problem is that if you have diabetes, so not only are you going to have to be checking your blood sugar, you're going to have to be monitoring, maybe you have a patch, maybe you have a blood draw. Some of my clients have been diagnosed with type 1 diabetes. They have like a pump they have to use. But you definitely need to be watching your food intake. So if you get diagnosed with diabetes, you can lose vision, you can get neuropathy, which is like the nerves at the ends anywhere, any of your nerves, you can, it's nerve death, neuropathy. You can literally lose function of your nerves. There's people I've heard of that have had, toes removed or part of their feet removed, and they're having problems with their feet and their nerve endings. So this is not one of those blood tests that you want to take lightly, and especially as you get older, it is harder to have a faster metabolism. So legitimately, your metabolism does slow down with age. So we are kind of fighting things as we get older. But I definitely want to encourage you, if you have not had a recent, like in the past year, fasting blood glucose, I would definitely go get your blood sugar checked, especially if you're having any symptoms and you just don't feel right. Like you're just not feeling like yourself. Sometimes that can be an indicator that you have a high blood sugar. All right, again, my name is Elaine Bintz, health coach, personal trainer. I hope everybody's having a great week, and I look forward to seeing you tomorrow. Have a great day. Bye.